Hey guys, Michael J. Crawford here, and I'm just admiring what is actually a beautiful view from my hospital room here in Murfreesboro, Tennessee. So I wanted to be frank and honest with you guys and just kind of let you know what was going on. And thanks to my wonderful nurse, Amber, and a healthy dose of Dilaudid, I am now in a position to where the pain level is reduced to where I can do this. Um, so, long story short, as you guys know, I've been dealing with health issues for the last couple of months, and this morning had a pain in my chest. Not like, it didn't feel like a heart attack or a stroke or anything, but just like almost felt like indigestion or gas, like just something just it didn't. It felt like it had something to do with my digestive tract, not cardiovascular or something like that. And so decided to, I had a doctor's appointment that morning. They happened to, while I was doing that doctor's visit, they actually did an EKG on me, and so they tested my heart, and everything was fine. They tested a lot of stuff while I was there, and all my numbers were great. They also tested my thyroid. That came out fine. So as far as by the book, everything seemed to be fine. So at that point, I figured, well, it probably is actually just gas or something, just pretty bad. So decided to just kind of relax, take it easy, and it would go away in a few hours. Well, a few hours later, it didn't go away. So Mrs. Antichecker took me to the ER, and they did a little bit of poking and prodding, and they finally they did an x-ray, which showed nothing. And I was beginning to think once again that this is going to be one of those circumstances where they do a bunch of tests and say, well, sorry, they didn't find anything, maybe another time. And that's the most frustrating thing in the world for me, is that I can't stand the idea of paying a significant amount of money to the healthcare system just for them to tell you that they don't know what's wrong with you. Well, then they did an ultrasound, and they actually did find something. And so when they did the ultrasound on my gallbladder, they found that not only did I have a significant amount of gallstones, and they were rather large, but at least one of them was, I can't remember the technical term, but it wasn't where it was supposed to be. It was like deviated from the norm, which was causing a problem with my liver. It was causing basically an infection in my liver, which is why when they did some blood work, my liver numbers were coming back bad. And so they were actually concerned that I might have hepatitis until they did the ultrasound and found these gallstones. So here we are now. It's about 8 hours later, and so I'm staying the night here at the hospital. Tomorrow morning, my understanding is, well, they're going to be doing, it's not exactly an MRI, but they explain that it's a procedure similar to an MRI, where they're going to look at the gallstones so that they can identify and locate the exact location of the one that is deviated specifically. And then they're going to go in surgically and remove the gallbladder as well as the deviated gallstone. And then I'll probably have to take some antibiotics and stuff for some time to clear out any infections and stuff. So, that's the update in a nutshell. The ironic thing, not ironic, just I guess the frustrating thing about all this is this really has absolutely nothing to do with the stuff that the neurologist has been dealing with the lesions that they found in my brain, with the lack of dexterity in my fingers, and my lack of focus and all that. That's all completely unrelated to this. It's just, man, it's been a messy couple of months. But I do want to say a couple of things here in this video. I know I've rambled on for over 5 minutes now, and I apologize, because I guess, here we are the night before a surgical procedure. It can be a little nerve-wracking, especially when it's a surgical procedure you were not planning on. And, when you have surgery, bad things can happen, and you start thinking about, what if it goes wrong? And so a couple of things I want to make sure that I get this out there is that, as many of you know, I'm not the only person in the nerd community having health problems right now. And most notably, I want to point out that my good friends, Bird of Prey 5, Rambling Canuck, and Positive Candor have all been dealing with very recent developments in their health as well. And so, for those of you that are believers of any kind, I would ask you to keep them in your prayers. And for those of you that can, if there's a way to do so, I don't know if all of them have. I know on Bird you can. I'm not so sure on Rambling Canuck or Positive Candor. If you can, support their channels and just help them out. Support them from a moral standpoint. That's I will tell you that one thing that's really helped me is all the well wishes that I've gotten from many of you. And even though well wishes don't pay the bills, they are greatly appreciated, because sometimes someone will say something that you just need to hear, especially when you're having a really bad day. So I know I truly appreciate it. I know that Mrs. Anti-Trekker does as well. And I know that Bird, Rambling Canuck, and Positive Candor do as well when they hear it. So please offer them your moral support, and when you can, offer them your financial support. Remember, we are one community. We need to look out for each other when we can. I would also ask you to support this channel, but I understand I'm not here just to beg for money. I just want to make sure that I get out there my well wishes to those 3 individuals, because they've all been good friends to me and this channel. I wouldn't be here if not for them. So thank you, Bird. Thank you, Rambling Canuck, and thank you, Positive Candor, for being my friends this whole time, even when I haven't been the easiest person to be a friend with. And so hopefully the surgical procedure goes well. And my plan, let me tell you, as far as this week is concerned, is honestly just recover from the surgery and do the best I can. However, I will do everything in my power to be ready for movie night with Matthew this Friday, because I have a wonderfully bad movie to watch with Matthew this Friday night. And so I think that'll be a great way to finish off a really bad week, is with a really bad movie. And but as far as in between now and then, no promises. If I have some energy, maybe I'll do a live stream here or on Twitch. But, with all that's going on, I can't promise you guys anything. So I've rambled on long enough. You guys, thank you again for being my friends. Thank you for being my supporters. And just thank you for being such a wonderful community. Take care.